Dr. DellaVecchia, congratulations on becoming the 171st president of the Pennsylvania Medical Society. It's an honor to be here with you in this historic building to talk about your presidential initiative, which is how is advanced technologies going to impact physicians, how they practice in healthcare in the near future. And really, given the changes in healthcare and COVID-19, I think this topic is more timely now than even just a couple months ago. What are advanced technologies and how do you see them impacting the practice of medicine in the future?
Well, there are many advanced technologies. If we look back not too long ago, even with the innovation of the computer and the personal computer, the innovation of electronics, the innovation of the internet, the acquisition of medicine, information is just pronounced all over. Okay, these data are already being compiled. The technologies themselves, or some of the hardware devices which we'll get into, such as the nanotechnology, the small submicroscopic technologies that can invade your body and do diagnostics and do therapeutics. Robotics will be a big aspect of this. We've seen robotics come, to the point where they can distinguish parts, they have their own set of vision, their own input of information. If you look at some of the production of automobiles today at the advanced factories, you'll see very human lack in the actual production of the automobile. It's robotics working at high speed, working at great precision. So we think that all of these aspects will pervade medicine, because we have to remember that medicine is roughly, what, Marty, 1/7, 1/6 of the gross national product. So the more advanced, the more efficient, and the more cost efficient we can make it, the better it'll be for humanity.
In listening to you, it sounds like some of these technologies, it's not future, it's happening now. Can you talk a little bit about that? How is it starting to permeate itself within healthcare today when you were talking about robotics and artificial intelligence?
Well, if you look at the data acquisition, we're living our daily lives, but every moment we're living it, data is being collected. They know from your cell phone exactly where you're standing, exactly what you're doing, exactly how you're moving, how many steps, how many calories you're burning. So that's all constant data acquisition. If you stockpile that with the data banks that they already have on you, where you live, the medicines you've taken in the past, your family history, it is a tremendous amount of information. If you look at some of the robotics, as you're going through different things, such as even toll taking, now your car is analyzed when you go through the toll. They don't have a toll taker. It knows where you are, it knows your account, knows where to take the money from your account. This is all data compiled by different systems. And that'll be even more prevalent in medicine in the future.
When we're talking about this data collection, it almost sounds like the development of predictive modeling to anticipate behaviors or bad behaviors in some cases, not walking enough, not exercising. So how do you see this data and these advanced technologies impacting or changing the practice of medicine for physicians?
That's a very good, insightful question, because what we want to do in medicine is we like to heal people, but we also basically want to practice preventive medicine. And to do that, we collect data and we figure out what your risk factors are. So we're going to do your family history along with your lipid profile, along with your work history, along with your exercise history, and know what you're at risk for in the future and try to bring down that risk according to certain mathematical algorithms and certain procedures which we can do on you. So it'll be a lot more of preventative medicine in the future, predicted by the algorithms that we piece together.
So most physicians don't go to medical school and residency to be mathematicians. So how can a physician work with the change? How can they adapt to the change? How can they be part of the change with these advanced technologies? Because they're coming.
They're coming. We won't be able to stop them, and it'll be a good thing, I think, when they come. One of the things we have to do, and what we're going to try to do with my initiative, is educate the present physicians of what's coming down the pike and how to adapt to it and how to be part of it, and more importantly, how to determine where it should be for patient care. The medical students that will be trained in the future are going to be trained greatly different from myself and people of my peers. What they will be is a lot more analytical, a lot more interface with computers, a lot more interface with advanced technologies. Just as we are in this historic place, you know, we have downstairs examples of the first stethoscope, okay, which is nothing more than a cone that you held up to your ear. But since then, we have different stethoscopes that were based on acoustics. Now we have stethoscopes that are based on electronics. Those electronics are analyzed before they hit your ear, and they're ported up, you know, through Wi-Fi and analyzed once again. So that'll be the type of doctor we will be training in the future. But hopefully we will still be able to maintain the art of medicine along with the advanced science.
So Dr. DellaVecchia, you mentioned your initiative. Can you explain to the delegates watching the video, as well as to our members who will be able to see this, what is your initiative and how will it help members understand advanced technologies?
What we're trying to do with my initiative is to bring the membership up to what's coming down the pike with the advanced technologies, of which there are many, such as nanotechnology, robotics, biosensors, and of course artificial intelligence. We will have to be a part of this, but more importantly with the initiative, I want us to be able to determine for the care of the patient where these advanced technologies go. And through a series of lectures, through a series of interviews with some of the real movers and shakers in those fields, I hope we can accomplish this in the coming year.
You know, I look very much forward to working with you this year as president and advancing this initiative. And truly, I think it's the start. It's an exciting time, and to see where technology can go to help physicians, to help patients have better outcomes, to remind patients how to be better patients and take their medications. It's truly an exciting time. Dr. DellaVecchia, thank you so much for sharing your initiative with us, with the delegates. And truly, I look forward to working with you in this year to come, and quite frankly, in many years, to have physicians ready for advanced technologies in their practices. So thank you again.